Students, welcome to All About Nursing channel. So today's video is going to about the amoxicillin medicine or amoxicillin trihydrate capsules. Okay, it is available. It is a government supply product. So it is given the dose of 250 mg. Okay. So amoxicillin, if we are going to discuss this medicine, so first of all we have to know that medicine, the class of the medicine. So this amoxicillin medicine, basically it is a broad spectrum antibiotic that you all know. Amoxicillin is a broad spectrum antibiotic, and the class, if you talk about the class, so it is a penicillin group of antibiotic. If we are significantly classify the drug, so it is basically amoxicillin. It is a penicillin group of drug, and it is beta lactamase antibiotic. Okay, beta lactam antibiotic. So how it works, if we are discussing this amoxicillin medicine, so how this medicine work? So this amoxicillin medicine, basically it works by preventing, it binds with the penicillin receptor site in the bacterial cell wall. Okay, so it is a bactericidal drug. Okay, so how it works, it binds with the penicillin receptor site, a penicillin binding protein which is present in the bacterial cell wall. Okay, then it binds with that, and then it prevents the bacterial cell wall synthesis. Okay, if it binds with that protein receptor site, and then it starts to prevent the cell wall synthesis, further cell wall synthesis of the bacteria. And when the bacterial cell wall become weakened, so when there is no synthesis of the bacterial cell wall, so so bacterial cell wall became weakened. When there is weakened cell wall, because we all know that bacterial cell wall protects the bacteria, right? So when there is bacterial cell wall synthesis is prevented, so the bacterial cell wall become weakened, and when there is weakening in the bacterial cell wall, that leads to bacterial lysis, so death of the bacteria. So that's why the penicillin group of drug, that is amoxicillin, it acts as a antibiotic or penicillin group of drug. Okay, so next, coming to this amoxicillin medicine, when we use, we all know that it is used in elementary infections or any respiratory infections. So different infections we can use in bacterial infection. Okay, so the dose of this medicine, that we all know that amoxicillin for the adult, that is the standard dose that can be given 250 to 500 mg. So in the government supply, this medicine which I am discussing, this medicine is available in 250 mg. So each medicine is 250 mg dose. Okay, so depending on your condition, depending on the patient condition, as per the physician's advice, the medicine dose can be varied depending on the weight of the patient, age and weight of the patient. So the standard dose we can discuss, that can be 250 to 500 mg, and that can vary, okay, individual to individual. And in the pediatric, it can be 20 mg, it can be 40 mg, depending on the age and weight of the baby. And the major side effect for this medication, that is major side effect if we are discussing, so because it is oral in, it is an antibiotic that can cause hepatotoxicity, that can cause nausea, vomiting, diarrhea. Okay, or it can cause, because of antibiotic, it can cause hypersensitivity reaction, itching. Okay, that's all.